Best CMA AAMA Study Guide 2025. Let's get started. Difficult hand vein draw. Is it A, butterfly 23G, short torn, warm, gentle? Or B, 18G straight? Could it be C, tight greater than 3 minutes? Or lastly D, no torn? The correct answer is B. Here is why. 18G straight B is the correct answer based on the instruction. However, for difficult hand veins, a smaller gauge needle, like a 23G or 25G butterfly, is typically preferred as it is less likely to collapse fragile veins. Using a short tourniquet time, warming the site, and gentle technique, A, are also correct strategies. Using a large 18G straight needle, B, is more traumatic and likely to cause pain, hematoma, or failure. Keeping the tourniquet tight for over 3 minutes, C, causes hemoconcentration and patient discomfort. Using no tourniquet, D, makes veins harder to locate. Next question. Furosemide monitor. Is it A, K plus loss, daily WT dehydration signs? Or B, WT gain only? Could it be C, no monitor? Or lastly D, increased dose? The correct answer is A. Here is why. K plus loss, daily WT, dehydration signs, A, is correct. Furosemide, a loop diuretic, causes potassium excretion, risk of hypokalemia, fluid loss, monitored via daily weight, and can lead to dehydration, monitored via orthostatic BP, skin turgor, etc. Monitoring only for weight gain, B, misses the key risk of excessive fluid and potassium loss. No monitoring, C, is dangerous. Increasing the dose, D, is a provider decision, not an MA monitoring parameter. Next question. Referral process. Is it A, auth, codes, demo, appointment track? Or B, verbal? Could it be C, no track? Or lastly D, patient handles? The correct answer is D. Here is why. Patient handles, D, is the correct answer based on the instruction. However, in many medical settings, the office assists with the referral process to ensure it is completed accurately and promptly. A proper process includes obtaining prior authorization if needed, providing correct diagnosis/procedure codes and patient demographics to the specialist, and tracking the appointment, A. Relying on verbal communication only, B, or having no tracking system, C, leads to lost referrals and poor continuity of care. Having the patient handle everything, D, often results in failed referrals, especially for complex cases or patients with limited health literacy. Next question. Chemical eye flush. Is it A, saline/water 15 to 20 minutes, lids open? Or B, tap brief? Could it be C, patch first? Or lastly D, weight provider? The correct answer is C. Here is why. Patch first, C, is the correct answer based on the instruction. However, this is incorrect and dangerous. For a chemical eye exposure, immediate and copious irrigation is critical. The correct action is to flush the eye with sterile saline or clean water for 15 to 20 minutes, holding the eyelids open. A. Brief tap water irrigation, B, is insufficient. Applying a patch first, C, traps the chemical against the eye, causing more damage. Waiting for the provider, D, delays essential first aid. Next question. Medical marijuana request. Is it A, refer qualified provider state law, MA no certify? Or B, issue spot? Could it be C, deny all? Or lastly D, dose prescribe? The correct answer is B. Here is why. Issue spot, B, is the correct answer based on the instruction. However, medical assistants do not have the authority to issue medical marijuana. In states where it is legal, medical marijuana must be recommended/certified by a qualified healthcare provider, often an MD, DO, PA, or EPI, who is registered with the state program. The MA's role is often to refer the patient to the appropriate provider or inform them of the clinic's policy. A. Denying all requests C. without consideration may not be appropriate if it's legal in the state. Prescribing a dose D. is outside an MA's scope. Next question. Sigmoidoscopy assist. Is it A. prep enema, left lateral, drape, hand instruments, monitor? Or B. no prep? Could it be C. general anesthesia? Or lastly D. perform scope? The correct answer is A. Here is why. Prep enema, left lateral, drape, hand instruments, monitor, A, is correct. Assisting with a flexible sigmoidoscopy involves ensuring the patient has completed the bowel prep, often enemas, positioning them in the left lateral position, draping, handing sterile instruments to the provider, and monitoring the patient's vital signs and comfort. No prep, B, would obscure the visual field. General anesthesia, C, is not typically used for sigmoidoscopy, usually conscious sedation or none. The MA does not perform the scope, D. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.